Do you know why some men are at higher risk for developing prostate cancer? Knowing the key factors is your first line of defense. This video will provide vital information for you, your loved ones, and especially if you're an older man or of African descent. Your health is paramount. Cancer is a disease in which abnormal cells grow out of control. These cells can invade nearby tissues. They can also spread to other parts of the body, a process called metastasis. Prostate cancer originates in the prostate gland. This gland is part of the male reproductive system. It is located just below the bladder. Its main function is to produce part of the seminal fluid. This fluid transports sperm. The prostate is vital for reproduction. Over time, the prostate can enlarge. There are two main types of growth. One is benign, not cancerous. The other type of growth is malignant. This is prostate cancer. It's crucial to understand the difference. Identifying risk factors is essential. It helps us know who might be at greater risk. This doesn't mean you'll get cancer. It means you need to be more attentive to your health. Knowing your risks empowers you. It allows you to take preventative measures. It also helps you seek early detection. Early detection greatly improves the prognosis. It's an act of self-care and responsibility. A risk factor is a variable or situation. It increases the likelihood of developing a disease. For prostate cancer, there are several well-identified risk factors. Recognizing these factors is the first step. It prepares you for the conversation with your doctor. It motivates you to follow a proactive health plan. There are several factors that increase your risk. Some you can't change. Others can be influenced by your lifestyle. Let's detail the most important ones. Pay attention to which ones apply to you. This information is vital to your well-being. Age is the most significant risk factor. The older you are, the greater the likelihood. The risk increases considerably after age 50. However, age increases the risk of both. It's estimated that an 80-year-old man has a very high probability of developing some type of prostate cancer. This probability can be close to 80%. Not only is the risk higher, prostate cancer in African American men often presents earlier. It also tends to be more aggressive. Genetic factors may be involved. Socioeconomic factors or access to medical care could also play a role. This is an area of active research. For African American men, early detection is even more crucial. Conversations about risk must begin earlier. It's vital to be informed and proactive. Having a family history of prostate cancer increases your risk. This applies if your father or brother has had it. The risk is higher if your relative was diagnosed at a young age. Family history of other cancers is also relevant, specifically breast or ovarian cancer in female relatives. This may indicate the presence of shared genes. Mutations in certain genes can increase risk. The BRCA1 and BRCA2 genes are well-known examples. These mutations are associated with breast, ovarian, and prostate cancer. In addition to BRCA, other genetic mutations are associated. Lynch syndrome is one example. This syndrome increases the risk of several cancers, including prostate cancer. Knowing your genetic profile allows you to make informed decisions. You can opt for more intensive monitoring. It's another tool in prevention. Although rare, men can develop breast cancer. If a man has had breast cancer, his risk of prostate cancer increases. This is due to possible shared genetic mutations. As we mentioned, genes like BRCA2 are implicated. These genes increase the risk of both cancers. This is another indicator to be aware of. Some environmental or occupational exposures increase the risk. Agent Orange is a well-documented example. This chemical was used as a defoliant in the Vietnam War. Veterans exposed to Agent Orange are at increased risk, as are people exposed in certain industries. Repeated or prolonged exposure is a concern. Other chemicals and pesticides are under investigation. The relationship isn't always as clear as it was with Agent Orange. But occupational exposure is an area of interest. A diet high in saturated fats may increase the risk, especially fats from red meat and high-fat dairy products. A diet low in fruits and vegetables may also play a role. Obesity has been linked to more aggressive forms of prostate cancer. Maintaining a healthy weight is beneficial for overall health, including reducing the risk of several cancers. Lack of physical activity could also be a factor. Regular exercise has many benefits. It helps maintain a healthy weight and improves overall health. Chronic inflammation of the prostate, prostatitis, has been studied. Some studies suggest a possible link. However, the relationship is not entirely clear. Prostatitis is common and generally doesn't lead to cancer. But chronic inflammation could, in theory, promote cellular changes. More research is needed in this area. Some STIs have been investigated as possible factors. Gonorrhea and chlamydia, for example. The theory is that they can cause chronic inflammation. As with prostatitis, the evidence is inconclusive. Most men with STIs do not develop prostate cancer. But maintaining good sexual health is important for many reasons. If you identify with one or more of these factors in your life, especially if you're an older man or of African descent, or if you have a strong family history, this shouldn't cause you to panic. It should motivate you to be proactive about your health. It's a sign to talk to your doctor. Your doctor will assess your individual risk based on your factors, medical history, and overall health. Together, you can design a monitoring plan. This plan may include screening tests. The most common is the prostate-specific antigen, PSA, blood test. It may also include a digital rectal exam, DRE. The age at which screening begins varies. For the general population, it often begins around age 50. For men at higher risk, African Americans, family history, it can begin earlier, at age 40 or 45. Diagnostic imaging, such as MRI, may be helpful, especially if there is suspicion of abnormal growth or if the PSA is elevated. The goal is early detection. If cancer is found, a timely diagnosis allows for more effective treatment. This significantly improves the chances of recovery. While you can't change your age or race, you can influence other aspects. Adopting a healthy lifestyle is one way to reduce your overall risk. Maintain a balanced diet rich in fruits, vegetables, and whole grains. Limit saturated fats and red meat. Exercise regularly. Maintain a healthy weight. Don't smoke and limit alcohol consumption. These actions benefit your overall health. They reduce the risk of many chronic diseases, including, possibly, prostate cancer. Talk openly with your family about your health history. This can help other members understand their own risks. Communication is key. Understanding your risk factors for prostate cancer is a crucial step. It allows you to take control of your health, especially if you're an older man, African American, or have a family history of it. Don't wait until you have symptoms. Early detection is your best ally. Talk to your doctor about your risk and the right monitoring plan for you. Take action for your health today. Review your risk factors. Schedule an appointment with your doctor to discuss screening. Share this vital information with the men in your life, your father, brothers, sons, friends. Subscribe to our channel for more preventive health information. Ring the bell so you don't miss our next videos. I take care of myself, I take care of others, we all take care of each other.